Namaskar. In my opinion, yoga effectively provides the support required to improve the physical and psychological health of breast cancer patients. Breast cancer is a cancer formed in the cells of breast. Usually, cancer develops in cells from the lining of milk ducts and the lobules that supply the duct with milk. There are two main types of breast cancer. Those developing from the ducts are known as ductal carcinoma, while those developing from lobules are known as lobular carcinomas. Apart from these two types, there are 18 other subtypes of breast cancer. Even science has not been able to identify the cause of cancer, and that too breast cancer. But some risk factors are being a female of older age, family history of breast cancer, not having any children, lack of breastfeeding, high levels of certain hormones, certain dietary patterns, obesity, and deficiency of vitamin D. The success of the treatment of breast cancer largely depends on early diagnosis. So now, let us see some common symptoms. These include a lump in the breast or thickening that feels different from the surrounding tissue, change in the size, shape, or appearance of the breast, change in the skin over the breast, such as dimpling or new inverted nipple, peeling, scaling, crusting, or flaking of the pigmented area of skin surrounding the nipple or the breast skin, and the redness of skin over the breast may also be symptom of cancer. The kind of treatment of breast cancer depends on several factors such as the stage of cancer, overall stage of patient's health. The conventional treatment options available are radiation therapy, surgery, biological therapy or targeted drug therapy, hormone therapy, and chemotherapy. In many cases, it is observed that as soon as breast cancer is diagnosed or treatment is started, the patient may go through severe psychological distress. This directly impacts patient's quality of life. Therefore, intervention techniques are essential to reduce treatment-related distress. Yoga offers such mind-body intervention and is becoming immensely popular among cancer patients. Yoga also restores homeostasis, which is the process by which the biological system maintains stability while adjusting with conditions which are more suitable for survival. Now let us see the yogic management of breast cancer in detail. Yoga primarily focuses on four important aspects of lifestyle to manage any disease: ahar, food; vihar, relaxation, recreation, exercises and sleep; achar, behavioral pattern; and vichar, thinking process. Let's discuss ahar first. This includes diet and nutrition. As the treatment of cancer like chemotherapy and radiations alters the taste buds, it is important to serve the patient whatever he or she likes to eat. The priority here is for the patient to eat. Among foods, sattvic food is very good as it is low in spices. It is natural and light on the digestive system. Person should drink a lot of water to wash out toxins. In cancer patients, iron levels are low. So, have iron-rich foods such as lentils, chickpeas, beans, spinach, dried apricot, raisins and figs. During treatment, sometimes patient is unable to eat. So, take small and frequent meals like fresh fruits, yogurt, smoothies, soups, sprouts, salads and nuts. Often doctors suggest avoiding raw foods and salads to reduce the risk of contamination and infection as the immunity levels are low. Eat vitamin C. Vitamin C rich foods such as citrus fruits, bell peppers, and tomatoes to reduce toxicity caused by the medicine. Having lemon water, ampana, fresh fruit juices, coconut water, buttermilk are very soothing. Pineapple in the form of fresh juice and slices help in fighting the side effect of radiations because they contain bromelain. Use homemade mouthwash like soda bicarb for mouth sores or ulcers that works like prevention during chemotherapy. Foods like ginger, cabbage, raspberry, turmeric, grapes, and broccoli are very good. Garlic, oyster mushroom, and green tea, although considered rajasic, can be had in small quantity as they are known for their anti-carcinogenous property. Avoid tamasic food completely unless one is using ice cream to reduce the nauseatic feeling. Avoid consumption of tobacco and alcohol. Next, let's move on to Vihar, which is about rest and relaxation. Here, it is important to listen to one's body. Take rest after surgery, chemotherapy, or radiation, and slowly start to take some small recreational activity. If one is feeling sleepier than usual, maybe at odd hour, then one should sleep. In fact, one should sleep 1 hour extra as it helps to repair and rejuvenate. Spend some time of a day on some hobby to distract the mind from the illness to something positive. Playing cards or a craft classes, joining in community which does a lot of creative work, like making handmade badges or a cards for a charity sale. One should live an active life, but not to the point of fatigue. Due to reduced immunity, indoor activities are better. One must avoid crowded public places. Doing light gardening gives a feeling of nurturing, and this will have a positive effect on the mind. Going for a light stroll in the morning or in the evening and being in the midst of nature also have a therapeutic effect. Relaxation is very essential in a healing process. Practicing conscious relaxation like shavasana as often possible. This would help in reducing fatigue and pain. While waiting for one's turn at the doctor, the mind may become disturbed by seeing other people suffering. Avoid talking to other patients and practice Nishpanda Bhav. Spend quality time with family and loved ones. We will now move on to the third aspect, Achar, everyday activities. As one starts recovering, one should get involved in little household duties. This helps one to become busy and also helps developing some more strength. It is important to maintain a high degree of hygiene and sanitization in the living environment to avoid the risk of infection. Taking care of oneself and being in a regular touch with doctor is essential to understand this disease and have a realistic perspective about it in order to take appropriate measures. Include pranayams in your daily routines as they have a positive effect on immune function. Autonomic nervous system is imbalanced and psychological stress related disorders. Cooling pranayams such as Shitali, Sitkari, and Chandrabhedan. These pranayams have been useful in managing chemo-induced nausea and vomit and excess heat generated into body due to radiation. Pranayam known as Anulom Vilom helps to bring balance into our body. Include Rechak Pranayam to let go fear and brooding. Hyperventilation breathing techniques such as Bhastrika for depression, Kapalbhati and Ujjayi Pranayama works as antidepressant as well. Gentle stretching yogasanas such as Yastikasana, Konasana and relaxation techniques shown to be effective in managing fatigue, pain and sleep problems. All asanas can be practiced depending on patient's strength and physical stamina. So, one should start slow. A regular asana practice can boost self-esteem, can boost strength and overall physical condition. It also provides steadiness, it helps improving circulation, and it helps relax muscle tension to speed up the recovering process. Talasana, Gomukhasana, Bhujangasana, Garudasana helps to increase circulation in the lymph node under armpits, which are generally affected in those suffering from breast cancer. So, once immunity is low, the risk of infection is high. One should take care while doing any difficult physical activities that involves getting cut and scratches on one's body. Animals like dog are known to be good companions and gives emotional support to a patient who is recovering. However, one must be careful about the hygiene level and avoid contact with pets and different animals when in doubt in order to avoid infection in the body. Take some mild sunlight on the body in the morning as well as in the evening. Lastly, we come to the most important aspect, and that is vichar. Focusing on one's own journey is important because management and recovery in cancer patients differs from one person to another. Concentrate on what needs to be done with dharma bhav rather than going into negative thinking. Practice pratipaksha bhavana. In this technique, you constantly weed out unworthy thought and replace them with a positive, worthy thinking. Write 10 positive points every day in a diary. Patients suffering to the emotional strain of the cancer diagnosis may also have depression and acute fear of death. Undergoing various invasive, rigorous treatment may also heighten anxiety. Developing the attitude of Ishwar Pranidhan helps to scale through this stressful phase of life. This can be practiced by surrendering all your feelings and thoughts to higher reality. Believe that you will be looked after. Reading some nice scriptures and listening to satsangs, bhajans, kirtans, and performing other devotional activities are helpful in cultivating Ishwar Pranidhan. Practice Sakshi Bhav or a witness-like attitude and observe your body objectively without getting too involved. Mind sound resonance technique that involves chanting and meditating on sound like Om as a mantra and other mantras has proven to reduce anxiety and generate calmness. Connect with people who have recovered from cancer and are living a positive and productive life. This helps one realize that this is a temporary phase and that this too shall pass. It fosters Anitya Bhavana in a patient. Sharing sorrows and joys with like-minded people, such as spouse, family, or friend, helps to guide away this difficult phase. During the treatment, one might experience high phases of irritation. Practicing Mauna or observing silence at such time is effective. These yogic techniques will surely help in mind-body intervention after diagnosis and treatment of breast cancer. the patient will be able to respond to the treatment positively. They will find joy in living life by appreciating each new day with a sense of wonder. Namaskar.